Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's blog, I've shown you how to be aware and present in family meetings with the intensive care team. You can check out last week's blog if you're clicking on the link below this video. In this week's blog, I want to teach you why it's so important that you disrupt before you are being disrupted when your loved one is critically ill in intensive care. If your loved one has been admitted to intensive care for critical illness, your worst nightmares have become a reality. The fear of the unknown, the fear of the future, if there is any, for your critically ill loved one is real and tangible. You are way outside of your comfort zone, and your levels of frustration, stress, anxiety, overwhelm have skyrocketed. Worst of all, the vulnerability you are currently feeling is real and tangible and is literally right in front of you, and there appears to be no escape. You, your families, and your critically ill loved ones' lives have certainly been disrupted. The definition for disrupt in the Free Dictionary stands for to throw into confusion or disorder. After I have worked in intensive care nursing for more than 15 years in 3 different countries, and after I have looked after literally thousands of critically ill patients and their families, I have seen over and over again that 99% of families of critically ill patients in intensive care have no peace of mind, they have no power, they have no control, and they have no influence. Because families of critically ill patients are so far outside their comfort zone, and they are not prepared when basically shit hits the fan. And why would you prepare yourself for something that may or may not happen? But given that you are here, and given that reality has struck you and your family in one of the most unpleasant ways there can ever be, you are certainly looking for answers. Now, given that you, your family, and your critically ill loved one are in a situation where your lives have been disrupted, let's quickly look at the other side of the coin, and let's look at the intensive care team. The intensive care team, on the other hand, doesn't feel disrupted, because they see critically ill patients and their families day in and day out. New patients are coming in every single day in a busy intensive care unit. Critically ill patients live and they die, or they stay in ICU for long periods of time. In any case, intensive care is a busy, dynamic and volatile environment, and if the intensive care team felt disrupted every single time they are dealing with a new major crisis, they wouldn't be in a position to run such a busy place. The intensive care team therefore has scripted their plot and agenda well in advance, before it was even remotely on your radar that one of your family members might be admitted to intensive care one day. Therefore, the intensive care team doesn't feel disrupted by whatever drama is coming through their door. They know they have the upper hand, and they know that you and your family, generally speaking, have no peace of mind, no control, no power, and no influence. The intensive care team therefore is in a position of perceived power and perceived authority. They've been granted that perceived power and the perceived authority over many decades, if not centuries, where society has wrongly made people believe to trust doctors blindly. And you can see, hear and feel in every interaction with you and your family that the intensive care team speaks over you and at you rather than entering into a genuine dialogue. You and your family can see, hear and feel in every interaction that the intensive care team doesn't really have the inclination to answer the many questions you have. After all, the people within the intensive care team are all very accomplished, very smart, highly intelligent and academic people that shouldn't be questioned, and they shouldn't be robbed of their precious time. Or so you think. Therefore, the 99% of families of critically ill patients in intensive care who have no peace of mind, no control, no power and no influence retreat back into their place. They are not taking a stand, and they passively let their lives being disrupted by a major and unpleasant force, and they are passively hoping for things to get better. However, hope is not a strategy. If your loved one is critically ill in intensive care and is very unstable and in a very critical condition, or is in a life-threatening situation, or is in intensive care for long-term treatments and long-term stays, or is having a severe or traumatic head or brain injury, or is threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order, or is even approaching their end of life in intensive care. Do you really feel that hope in such situation should be your strategy? Given that intensive care is the industry that it is nowadays, with millions of dollars exchanging hands every single day, with patients competing for scarce and precious intensive care beds, with intensive care teams and hospitals competing for funding, and with intensive care teams competing for medical research grants, and with intensive care teams knowing what they say and how they are going to say it to families of critically ill patients, hope can never be your strategy. If hope is your strategy, you and your family are doomed. And don't get me wrong here, I'm the first one to advocate for positive thinking, and I even wrote a blog about it. How to stay positive if your loved one is critically ill in intensive care. You can click on that blog below this video on the link. However, that can only ever be a byproduct of another strategy that focuses on you and your family having peace of mind, control, power and influence. Even in the most challenging of situations there are in intensive care, where your critically ill loved one is very unstable and in a very critical condition, or is in a life-threatening situation, or is in intensive care for long-term treatments and long-term stays, or is having a severe or traumatic head or brain injury, or is even threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order, or if they are even approaching their end of life in intensive care. Now, if you and your family have found yourself in any of those situations, you also know by now that the intensive care team holds all the decision-making power. They hold all the power about how they position your critically ill loved one's diagnosis and prognosis. And they hold all the power about the care and the treatment they are offering or not offering to your critically ill loved one. That's how the intensive care team rolls, because 99% of families of critically ill patients in intensive care who have no peace of mind, no control, no power and no influence don't question. They don't look what's happening behind the scenes in intensive care, and they just simply don't believe that they can have peace of mind, control, power and influence. Therefore, in order for you and your family to have peace of mind, control, power and influence, you need to do some things that at first might feel counterintuitive. However, if you don't take those counterintuitive steps, you and your family will continue to feel disrupted, and you and your family will continue to have no peace of mind, no control, no power and no influence. If you and your family don't look at what's happening behind the scenes in intensive care, if you and your family don't look and don't realize that you can't really afford getting this once-in-a-lifetime situation wrong, if you and your family continue to take everything for face value the intensive care team is telling you, or if you and your family don't understand that the politics, the dynamics, the power play, the medical research interests, the intrigue, the psychology, and the hidden agendas of the intensive care team are all part of why the intensive care team positions your critically ill loved ones' diagnosis and prognosis the way they have done. And if you and your family don't understand that the financial interests the intensive care team has have a huge impact on how the intensive care team positions your critically ill loved ones' diagnosis and prognosis, then you and your family continue to feel disrupted. So, what's the solution to the dilemma? The solution to the dilemma is that you need to start disrupting. And by that I mean that you and your family need to quickly bring yourself in a position where you have solid and proven strategies that will help you to manage the intensive care team. Your solution to the dilemma is to start acting and behaving differently compared to the 99% of families of critically ill patients in intensive care who have no peace of mind, no control, no power and no influence. And you can trust me that the minute you start doing your own research, the minute you start doing things differently, the minute you take a stand, the minute you start asking the right questions, the minute you're not taking no for an answer, the minute you stop being intimidated by the intensive care team, and the minute you are more proactive, that's when the intensive care team feels disrupted, because that's not what they are used to. And I can assure you that if you do all these things, the intensive care team will notice and things will change for you very quickly. The intensive care team feels disrupted because they can't go on autopilot any longer, and they realize that their positioning will falter in light of you having done your own research. The intensive care team all of a sudden realizes that they are dealing with a powerful family who has done their own research. They immediately know that you will do whatever it takes so that you will have peace of mind, control, power and influence. The intensive care team feels disrupted because you and your family know and understand that it's up to you to challenge the status quo and get the results that you want. So how do you do that? And how can you get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care. And it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section where we answer your questions, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from IntensiveCareHotline.com, and I'll see you again next week in another update.